My name is Zach Sherman. I'm the Executive Director of Pennie, Pennsylvania's health insurance marketplace. I'm really excited to be here today with Mayor Peduto's office to talk to you about this new state program and the ways in which we offer services, offer financial assistance, and connect Pennsylvanians to coverage. Mayor Peduto is expected to be here today, and we'll give some remarks a little bit later this morning. So starting at the top, we wanted to give you a broad overview of who we are and what we do, and where we came from, how this came to be. And the origin of Pennie dates back to 2019, when leadership across the state looked at how much we were paying for use of healthcare.gov, the federal marketplace, and realized there was a better, more affordable, more customer-friendly way to connect Pennsylvanians to coverage. This resulted in rare and unanimously passed bipartisan legislation. It passed both chambers of the General Assembly unanimously and was signed into law on July 2nd, 2019 by Governor Tom Wolf. The legislation created two programs that really work hand in hand together. The first is a state-based exchange, a state-based marketplace, Pennie, there to expand access to customer service, in-person assistance, and broadly coverage through the marketplace. The other program it created was an affordability program called reinsurance, which effectively works to reduce the cost of health insurance in the individual market from what it would have been had we stayed on healthcare.gov. We were able to fund this affordability program by the efficiencies and the savings created by running Pennie. It's just much more affordable and much more efficient to do so. We saved money, we invested that money in affordability, and it's already paying off. Premiums in the individual market in 2021 are on average 5% lower than they would have been had we stayed with healthcare.gov. So who are we? We're here broadly to improve the accessibility and affordability of individual market health coverage for Pennsylvanians. We do this by being the official health insurance marketplace for Pennsylvania. We have replaced healthcare.gov. Pennsylvanians who previously accessed coverage, marketplace coverage through healthcare.gov, we transitioned them over to Pennie, to the Pennie platform, and gave them the ability to renew into coverage. We are the home for high quality, affordable health insurance plans, and very importantly, the only source for the financial assistance provided to reduce the cost of coverage and care. Nearly 9 out of 10 of our customers receive some form of financial assistance, and on average, it's about $515 per month in savings. Question of who do we serve? We help individuals and families who don't have insurance through some other means, and that includes primarily their employer. If you're employed and you don't have health coverage for whatever reason through your employer, we exist to serve those families, and we exist to help be the difference between affording coverage and not. We want to help and serve the uninsured. The Commonwealth has come a long ways under the Affordable Care Act, reducing the number of uninsured across Pennsylvania, but there's still more work to do, and we want to do what we can to get that number as low as possible. And then lastly, a really big opportunity of being a new state entity is that we get to partner with other state agencies, namely the Department of Human Services, to operate what we call our no wrong door policy, which allows us to take someone who applies for coverage through us, who is eligible for medical assistance or CHIP, an easy pathway over to DHS to get them ultimately connected to medical assistance and CHIP. And we can do that through a state-based partnership that goes both ways. They also send people who apply for coverage through DHS our way if they're eligible for our programs. We have a number of tools and resources to help Pennsylvanians navigate what we know to be a sometimes very confusing and overwhelming process. Applying for coverage is complicated and is very personal. We know that some people need assistance along the way. So we have a dedicated call center. We have online self-service tools that allow people to sort and filter our plan options based on what's most important to them. So if you want to see what the lowest price plans are, if you want to see what your total out-of-pocket costs could be in a year, if you want to just see the plans that cover your doctor, your prescription drugs, these tools allow you to filter and sort that way. We've really expanded outreach and education sessions across the Commonwealth with this new program. We do as many opportunities as we can, like this one, partnering with local or regional organizations, state municipal governments to connect to communities to make sure they're aware of the services that we provide, that people might be eligible for financial assistance to reduce the cost of health coverage. And we partnered with thousands of assisters and brokers across the Commonwealth who are trained and certified on our programs, on our platform, on the plans offered through Pennie to provide tailored, regionally specific in-person assistance, virtual assistance for people who want that one-on-one care and assistance through the application process. And you can access these assisters and brokers either through our website or by calling our call center. A really important question for people interested in being connected to coverage is, when can I actually get covered? When can I get insured? And traditionally, there's an annual open enrollment period that happens every year. It runs from November through January 15th, where Pennsylvanians can come to Pennie, and if they're looking for coverage, no matter what, they can apply and get covered if they're eligible. This year is a little bit different as a result of the COVID-19 public health global health pandemic. We, in recognition of the fact that the pandemic has impacted the lives of all Pennsylvanians, in recognition of the fact that it's a public health emergency, we know that there are uninsured Pennsylvanians out there who need health coverage, and they need the protection that comes with it. And so we have, starting on Monday, starting on February 15th, we are opening up as a result of the pandemic. And from February 15th through May 15th, Pennsylvanians who are uninsured and or workers in transition, or anyone interested in looking at affordable health coverage options, they have a 3-month period running from February 15th to May 15th to come in and get covered. I mentioned the open enrollment period. Outside of open enrollment, traditionally, if you have some sort of qualifying life event, if you have some sort of change in circumstances in your life, that's another opportunity created for you. It's called a special enrollment period, where you can come in and get covered outside of open enrollment. There are specific qualifying life events tied into that. And Scott, if you could go to the next slide. All of them are listed here on the left side of the slide. The big ones are, if you lose your employer-based coverage, that's impacting your ability to have health insurance, and that triggers the 60-day period where you can come to Pennie and apply for coverage, and outside of OEP get covered. Other examples include relocating to Pennsylvania, or relocating from one part of the state to another, having a household change, having a baby, getting married, getting divorced. Those are examples of life events that trigger the special enrollment period. On the right side of the slide is just a little bit more information about the COVID-19 enrollment period that starts on February 15th. As I mentioned, all Pennsylvanians have been impacted by the pandemic and therefore are automatically eligible for this enrollment period. It really gives primarily the uninsured and those looking for different or alternative, more affordable plan options more time to come in and get covered. The steps, which are listed underneath here for taking advantage of this, is going to pennie.com or giving us a call, starting an application, selecting the COVID-19 enrollment period opportunity, and then just going through the regular shop and compare plans, enroll in a health plan. And as soon as you pay your first month's premium, more likely than not, with financial assistance to help pay for it, you will be covered. This slide gives you an overview, a sense of where the uninsured live across the Commonwealth. It's broken down by county. The darker the green, the county, the larger the size of the population that's uninsured. As you can see, the uninsured is concentrated in primarily in larger population areas, including Allegheny County. We know there's a number of we know we've made a lot of progress in Allegheny and Pittsburgh in reducing the uninsured, but there's still more work to do. And this slide gives you a little bit about how we chipped away at that in our first open enrollment period. We increased the number of insured in Allegheny by about 2,200 this open enrollment period. That's an increase of 7% or so. And then on the right, we wanted to give you all a sense of where we know the highest numbers of uninsureds live in Pittsburgh, broken down by zip code. So you can see in, well, Scott, if you can just go back for 1 second, sorry. For example, in the Wilkinsburg, Braddock area, there's almost 2,000 people uninsured still, based on the data that we have. So I'm now going to hand it over to my colleague Scott Yeager, who's going to go into a little bit more detail about different customer scenarios, trying to give you a little bit of a sense of how to navigate the process and how real life scenarios will play out in terms of applying for coverage and financial assistance through Pennie. Scott will also delve into the different avenues for applying for coverage and the different tools and resources that we provide to help people. Scott?
All right, thank you, Director Sherman, and thank you again to Mayor Peduto's office for hosting this introduction of Pennie to Pittsburgh and southwestern Pennsylvania. We do appreciate it. And to sort of piggyback on what Director Sherman had mentioned a little bit earlier about the COVID-19 enrollment period, and the fact that during the course of the year, even beyond the COVID-19 enrollment period that we have that runs from February 15th, this coming Monday, till May 15th. Beyond that, we have special enrollment periods that are triggered throughout the course of the year for individuals who have qualifying life events. And he mentioned those. The following scenarios are going to provide us with a little deeper insight into some of the situations that people can have during the course of the year that would provide them with an opportunity to contact Pennie or reach out to pennie.com and initiate health insurance coverage. The first scenario deals with Sarah Gibbons. Sarah Gibbons lost her job at a local bank due to budget cuts. She had good employer-sponsored benefits when she was at the bank. Shortly after Sarah's departure from the bank, she receives a letter from COBRA in the mail. Under COBRA, Sarah qualifies to continue her medical coverage that was once sponsored by her employer. The question is, does Sarah have another option, or must she sign up for health insurance through COBRA? The answer to that is workers in transitions like Sarah do have the option of applying for health insurance through Pennie as an alternative to COBRA benefits. Sarah may be qualified for financial assistance through Pennie that will make the health insurance options through pennie.com a more affordable alternative to COBRA. The loss of employer-sponsored coverage in this case is a qualifying life event that can trigger a special enrollment period at Pennie. Sarah will have 60 days from the date that she lost her employer-sponsored coverage to shop and apply for health insurance at Pennie.com. The next scenario is Brenda Ortega. Brenda is a sole proprietor, and she's recently taken a partner who moved from Philadelphia to Erie to be with her. Brenda and her partner have taken a huge step. They're adopting a child. Brenda and her partner do not have insurance. Who qualifies for insurance at Pennie.com? Well, the answer to that is Brenda, her partner, and the child that they're adopting all qualify for special enrollment periods at Pennie.com. Getting married, taking a partner, relocation to or within Pennsylvania, and adopting a child are all qualifying life events. In this case, Brenda would want to reach out to the Pennie call center at 844-844-8040 to discuss options for her partner, and their adopted child. Brenda can also get questions answered at Pennie.com. She can compare plans there, and she can secure coverage needed for her family. A special note here is that Pennie does and is here to not only work with individuals who don't have access to Medicaid or individuals who don't have access to employer-sponsored coverage. We're here to work with small business owners, with sole proprietors, with gig workers who, may be out there on their own, and in that they don't have access to affordable health insurance. Through Pennie.com and through our financial assistance programs, we're definitely here to provide those individuals with alternatives. Speaking of alternatives, Leslie Tran is a successful injury attorney with a thriving legal practice. Leslie's a single parent. Her daughter's name is Luna. Leslie believes that she makes too much money to shop for insurance on the individual marketplace. Leslie makes about $62,000 a year. Because of COVID-19, Leslie's legal practice only brought in about $48,000 this year. Would Leslie and Luna qualify for insurance and financial assistance at Pennie.com? To that scenario, Leslie, like so many small business owners in recent months, has had a significant reduction in income. A reduction of income can make Leslie and Luna eligible for financial assistance through Pennie.com and is a qualifying life event that can trigger a special enrollment period for them. Leslie should contact the Pennie Customer Service Center at 844-844-8040 to discuss her options, or she should visit Pennie.com. Now, with regard to one last scenario, Doris Young just moved to the United States from Australia. Doris works as a phlebotomist at a good hospital. Doris attends nursing classes at a local community college. And Doris just gained lawfully present status in the United States. The question is, does Doris qualify for insurance at Pennie.com? Doris, in her particular case, she gained lawfully present status in the United States. That is a qualifying life event. She can shop for plans, see if she qualifies for financial assistance, and purchase health and dental insurance options at Pennie.com. A special note is that moving to the Commonwealth of Pennsylvania from another country or state can trigger a qualifying life event and a special enrollment period. With that being said, I'd like to share a little bit with you about Pennie's customer experience. When we transferred our customers from healthcare.gov to Pennie.com, we wanted to create an environment where they had the ability to shop for health insurance in an anonymous, no hassle, no pressure fashion. At Pennie.com, they have the option to shop anonymously. They can also, with very little information, in fact, no personal information, they can determine if they're eligible for financial assistance. They can shop for plans, and they can ultimately apply for coverage and not have to worry about providing any personal information ahead of time. They're not forced to create an account. Um, we're Pennie.com. We believe that our customers should and should always be in the driver's seat. Um, with regard to um, with regard to financial assistance, Director Sherman had mentioned from a financial assistance perspective that 1 in 9, or I'm sorry, 9 out of 10 individuals at Pennie.com qualify for health insurance assistance. Um, we are, with regard to the Commonwealth of Pennsylvania, we are the only source for health insurance financial assistance to help lower the cost of coverage and care. Again, nearly 9 out of 10 individuals qualify for some assistance. And uh, as Director Sherman mentioned prior, there is a reinsurance program that is in place right now in the Commonwealth of Pennsylvania that has helped reduce and control the rates and premiums in the individual health insurance market. So it's one of our ways to ensure that rates are affordable for individuals, regardless of whether they qualify for financial assistance or not. In terms of financial assistance, and this is the great news, we have advanced premium tax credits. Those advanced premium tax credits help reduce the monthly premium. And as Director Sherman had mentioned, we have financial assistance that averages about $523 a month through our open enrollment period. With that, you can take a $700 a month or $600 a month health insurance payment, and you can reduce that to little or no cost in no time with advanced premium tax credits. With cost sharing reductions, we have metal tiers. 3 different metal tiers at Pennie. We have gold, we have silver, and we have bronze. Cost sharing reductions help further reduce out-of-pocket expenses like co-payments, co-insurance, and deductibles. But the trick to that is that you need to select a silver plan in order to qualify for the cost-sharing reduction. So, and to that end, about 47% of our customers do have a silver option. So it's a popular selection just because of that additional savings that you can gain. Now, with regard to health insurance, Pennie does not sell junk insurance plans. At Pennie.com, all of our insurance plans meet the 10 essential minimum health benefits of Affordable Care Act health insurance programs. We provide for emergency services, prescription drugs, maternity and newborn care, lab services, rehab services. And here's the good thing: you cannot be denied coverage due to pre-existing conditions. And if you're an individual under 26, you can remain on your parents' plan. So from that perspective, we we're honored to be in a position where we can, be that platform where Pennsylvanians can come if they have health insurance questions, if they need help connecting with the right type of health insurance options. Um, our goal ultimately is to make sure that their quality of life is preserved. With that being said, you can see our participating health and dental insurers are very, very well known. We've got, of course, individuals like Highmark, UPMC, Independence Blue Cross, AM Better, Capital Blue Cross, Geisinger, Delta Dental. There's Guardian, Dominion National. There are a host of quality companies that participate with us. And ultimately, in addition to the reinsurance program that helps save our customers money, in addition to the financial assistance that helps save our customers money, ultimately, we believe that in time, more competition in the marketplace will also contribute to customer savings. So, from that perspective, Pennie is striving, taking good strides every day to to make sure that our customers receive the assistance that they need. In terms of how Pennie assists customers, well, the first thing that you'll note is this is pennie.com. We are not pennie.gov. We are not pennie.pa.gov. We are a state agency, but we are pennie.com. We want to be approachable. We want to be uh, a source and a resource for all Pennsylvanians. If you have questions about health insurance, if you need guidance in terms of health insurance, we're a good starting point. As Director Sherman mentioned, we have a no wrong door policy at Pennie. If you reach out to us and you have questions, we will do our best to make sure that if we can answer those questions for you, we will. If we can't uh, find that solution for you, we will connect you with the resources and the individuals who can help you resolve those questions and inquiries. So from that perspective, we right out of the gate, we want pennie.com and our platform to be a place where people can self-service, where they can come on their own terms, where again, they're not required to create a customer account or they're asked for personal information until they actually make a decision to start an application and work through the insurance process. But let's face it, no one, no one is born with an inherent knowledge of health insurance. That just does not happen. So inevitably, across the journey that our customers would have with us, there are so many resources, free resources, and I need to stress this. All of the resources through pennie.com are free. Um, and those service related resources start with our customer service representatives. Our customer service representatives quite literally are one phone call away. You can reach out to them. There are language line services. So if translation is needed, we have that service available. We also have dedicated Spanish speaking customer service representatives, but most importantly, and this is critical to keep in mind, our customer service representatives at Pennie are very well trained in terms of insurance. They can provide unbiased assistance to customers, um, and guide them through the entire process, from exploring coverage options to looking at the finer points of plans, to determining if they qualify for financial aid, all the way through to applying for and securing that coverage that they need to protect their quality of life. Our customer service representatives do not work for an insurance company. That's an important thing to keep in mind. They work for our customers straight from the gate. Now, they are virtual. Okay, they're working from a call center. However, for individuals who would want to speak with someone from their neighborhood or local area, or their region of Pennsylvania, we have two options that are boots on the ground local resources. Number one, just like our customer service representatives, we have certified assisters. An assister is, once again, somebody who provides unbiased, no hassle, no pressure service to customers, and they work from community centers, they work from healthcare facilities all throughout the region. And they can provide that, again, that guidance to a customer, uh, you know, based on their own decision making. An assister, a customer service representative at Pennie, they will educate. And ultimately, the decision is the customer's. If the customer requires special assistance, licensed professional assistance, we do have Pennie certified brokers throughout the Pittsburgh region. Those Pennie certified brokers are licensed professionals in the Commonwealth of Pennsylvania that can really dig down into the finer details of an insurance plan, its options, its coverages, everything from specific physicians all the way through to specific medications. Um, a Pennie certified broker will be there in the Pittsburgh area to help you and your family get to a better place. So we have those three levels of service that are available. And again, 100% free to our customers. The only thing that will cost is, of course, your binder payment for your insurance premium. But any service that we have at Pennie is free to you. Now, speaking about our customer service center in big numbers, 1-844-844-8040 is the number that anyone can refer someone to. If you know someone who needs to explore health insurance options, dental insurance options, please make sure that they reach out to 844-844-8040. We are open Monday through Friday, 8 to 6 p.m. During open enrollment, we're open from 8 to 7 p.m. and Saturdays, 8 to 1. But most definitely, do not hesitate to refer someone to us if they need our help. Speaking of referring, you can refer someone directly always to Pennie.com. You can direct individuals and groups to us. Believe me, we are more than anxious to engage and to speak with those in the Pittsburgh region who need health insurance. As Director Sherman pointed out, there are about 43,000 uninsured in the Pittsburgh area, about 27,000 of which reside in the city of Pittsburgh itself. We've got a lot of wood to chop, and we need all the help we can get. And part of that is you can also share our information. Pennie is on Facebook. We're on Twitter. We also have shareable materials at agency.pennie.com. The agency.pennie.com is our agency website, but we have digital materials there that you can share as well. Also, anyone on this call who would have an interest in joining our outreach and education work group, we encourage that. Pennie's outreach and education work group meets on the first Wednesday of every month at 2 p.m. in the afternoon. And at that meeting, we value feedback, ideas, thoughts that people have about the exchange, because ultimately we have an operational philosophy here at Pennie that we're better today than we were yesterday, and we will definitely be better tomorrow than we were today. And we do that for our customers. Our customers, your friends, your neighbors, our friends in southwestern Pennsylvania deserve no less. We want to make sure that we're accessible and available for anyone who needs help, and ultimately who we can help get insured. So with that being said, I will open things up for questions. Leah, if Mayor Peduto is available and would like to make a statement. Mayor, thank you again so much for helping us get the word out in Pittsburgh. We appreciate it more than you know. And with that being said, I'll turn it over for questions or statements.
Thanks, Scott. The mayor was having some technical difficulties getting into our meeting today, but he does send his best to everybody who joined, and sends his gratitude to Pennie for hosting this session and helping connect Pittsburghers with affordable and reliable healthcare. Thanks.
All right, excellent. Well, do we have any questions?
Scott, through the chat, I received one question that I think may have just gone directly to me. So I wanted to call it out and answer it. And the question is, I noticed the deductibles and out-of-pocket maximums are very high for these plans. Are those to be used for preventative services mostly? So a couple things I would say to that question is, on the question of preventative services, Scott mentioned that all of the plans offered through Pennie have to cover the core set of 10 essential health benefits. One of those is preventative services, and another requirement related to preventative services is that those are all covered at no additional costs. So you do not need, for preventative services, anything that's qualified and designated as a preventative service, that's at no additional cost sharing. So your primary care visit, anything else that's qualified as preventative services won't cost you any more money. So that actually doesn't add to the deductibles and out-of-pocket maximum. And then the other thing I'll say around the cost of it, in particular for lower income customers, there's the additional financial assistance on top of the premium tax credits. We have the cost sharing reductions, which help reduce the cost of those. And if you're if your family household income is under 250% of federal poverty, you will be eligible to get that additional cost sharing assistance as long as you enroll in the silver plans available through Pennie. So you have to be eligible, and then to take advantage of it, you have to enroll in silver plans. But what that assistance does is effectively reduce the deductible and reduce the out-of-pocket maximums. And on the lowest end, it's very beneficial. We have a lot of plans of those CSR plans for the lower income folks that have $0 deductibles.
I'm not seeing any other questions in the chat. Participants can feel free to post their questions in there or just call them out if they have them. I was wondering if you could elaborate a little bit on the translation services that are available through your call line.
Sure, absolutely, Leah. We have, through the Pennie call center, we have, and again, the number is 844-8040. We have English and Spanish customer service representatives available. But in addition to that, we have a language line that provides translation and services for 250 plus different languages. So if you have an individual who, let's say, is fluent in Russian, you can have them reach out to our customer service center, request Russian translation, and the customer service representative can get a translator, a Russian translator, on the line so that they can have a fluent and effective discussion with them about health insurance, dental insurance, etc. Another important thing in line with that I'd like to point out is that through Pennie.com, in the lower right-hand corner of Pennie.com, there's a translation widget. And that translation widget can take our site from English to Spanish, from Spanish to Mandarin, from Mandarin to Russian. So we have alternative language options available through our website as well.
Thank you.
Mhm.
Okay, it seems like that's it for questions.
Okay. All right. Well, thank you again so much to everyone at the mayor's office for helping us coordinate this. We appreciate it more than you know. And if ever there's someone who needs us, please don't hesitate to reach out and provide them with our contact information. Okay.
Sounds great. Thank you so much.
All right, Leah. Thank
Have
you.
a good day, everyone.
All right. Be well. Bye-bye.